I'm Dr. Jonathan Messenger, Medical Director of Imaging Informatics for Baptist Health South Florida. I am also the Medical Director for South Miami Hospital, one of the hospitals in the Baptist Health system. I am a radiologist in Radiology Associates of South Florida, and we are one of the 10 largest radiology groups in the country. We are very well known for our subspecialty approach to imaging. We have dedicated programs in cardiac imaging. We have a very large neuroscience center throughout the entire health system. We recently opened a new cancer center on the Baptist Hospital campus, Miami Cancer Institute, and we have recently developed and significantly grown a lung screening program. The ability to actually customize the workflow within the system to accommodate exactly what I'm doing that day, rather than being confined to what the system will only allow me, was one of the major drivers in what we were looking for in workflow orchestration. The workflow orchestration tool allows us to really make use of our subspecialty training. So for example, there are some days that I'm just working in neuroradiology. That would be very simple to do. But there are other times that I come in that my responsibilities extend well across other subspecialties. Rather than having to monitor multiple work lists, multiple work filters, and clicking on different ones and going back and forth, what we were able to do was create an actual real-time work list that would accommodate exactly what my responsibilities were at that time. And I could just, for example, open up multiple different filters, similar to what we are already seeing online in a lot of the different online purchasing sites, where you can click on multiple different things to hone down to a particular group of products that you're looking for. It's the same exact type of thing. I can click on multiple different responsibilities for that day, whether it might be fluoroscopy at this hospital, x-rays at another hospital, or stat x-rays and neuroradiology, and combine all of that together into a work list that accommodates exactly what I'm doing that day. Tomorrow may be another thing, and I can create another work list. So it is really almost a living work list that is exactly what I'm doing at that time. What it allows me to do then is to focus more on what my responsibility is, rather than jumping between one thing and another. And so I'm able to really pay more attention to what I'm doing and what I'm supposed to be doing, which is looking at the images and reading the examinations and interpreting the results, rather than trying to figure out where am I getting my next case from and what am I going to do.